Yeah. I was just saying that when I was working at that toxic environment, it was mentally draining me and my entire family to the point where I was constantly angry, constantly cursing. I didn't recognize myself, and my husband told me that I can't live like this. So it's either you leave this job or I don't know what the alternative is, but it's just was not healthy. I reached my rock bottom and I was because I thought like there's no other jobs, right? I have to stick it out. That's what we're taught. Like you have to stick to your responsibilities. You made a commitment to this job, right? And I liked working with the patients. I liked making a difference. I was learning a lot, but ultimately it was just not safe for my mental well-being and for my kids and my husband and our relationship. So and you know what? God puts you where you need to be, and He got me out of there. And it was just a crazy story. It was actually a year ago exactly. And that's when I started thinking of doing childbirth classes. That's when the idea came to me. And now here we
It's
are,
like
a year
water.
later.
You just flowed
Yeah.
right into, well, let me use all my knowledge and what I can do to help families. That's essentially what I've been doing. I'm just like, you see holes in the system. I'm still
Yeah.
part of the system. I'm still working at the bedside, kind of like two parents, like I'm getting pulled in both two directions, you know? They're like, stay in line, follow orders, shut up and do what the doctor says.
Yeah.
Don't question things. Like, don't be so loud. Go with the flow. Get in line. Um, put your head down. Just keep your head down. Those are the actual words, and also through their actions that I get
Yeah.
from the hospitals, right? And
Yeah.
usually I'm a traveler, so I'm out of there in 3 months. So I'm like, okay, bye. So I can take some time between to do like dysregulate, re-regulate, just center myself and for my own mental health. Because if it's constant, then I don't know if I could do it. Like, so that's where I'm at right now. Like, can I even
Yeah.
do this like full time now? And I don't know. Like, I think I enjoy what I do at the bedside, honestly.
Same.
And I kind of like it's that thing, and I'm sure I'm not the only nurse to have felt it. Like, if I'm not there, like, who's gonna speak up? Who's gonna ask questions for each individual mom or baby, right?
Yeah.
Like,
You feel guilty.
but I can't have this savior complex, and I can't think I'm gonna
No.
make these big changes and
Because
sacrifice
you're
my health.
not. You're not going to change the system. Unfortunately, hospitals are a business and
Yeah.
they say they care about patient safety, and they do. It is our number one. But at the same time, do you know who's in charge of hospitals? They are not nurses and they are not doctors.
Mm-mm.
They may be the chairman, but ultimately
Mhm.
it's the business people who are signing off
Yeah.
checks and talking about how much staff you can have and what kind of equipment you need and things like that. It's just really sad to say that it's patients are just a number
Mhm. Yeah.
and
So are nurses.
let yeah 100%. And
And that's why
COVID
I think
showed
managers
that
are so important, managers and directors, because how they make the nurses feel, if they feel supported,
yeah
heard,
with a make a mistake yeah
yeah, a team, community,
hmm
like, oh, I have someone to support me over this, like the weight of the
100%
hospital system. They're reminding us the real reason we're doing this is not to
yeah
make the hospital money, it's to be there for these patients,
the
these
patients
women
yeah
that are coming in at their most vulnerable time. And we want to make sure this not only happens safely,
yeah
but respectfully.
right
Like, um, you know,
yeah
we're
100%
harming
they
them. I mean,
care
the big picture is I feel like we're doing a lot of harm. Like the statistics that I heard of inpatient trauma due to how the health providers are treating them.
hmm
Even it may not be full on obstetrical violence, but just ignoring their words, ignoring when they're asking a question or saying that they have a preference of something, and not at least at the very least having a discussion and seeing what we can do to get as close to that preference as possible safely, and that all the
right
risks are presented. Why is like Well, how is that going to hurt the hospital's bottom line? It's only going to help. Like,
But the problem starts with the doctors
they,
because they bring in the money and whatever the doctors say goes, even
yeah.
if they're not practicing appropriately, right? And they're not educating their patients. So it all falls back to us. Why was the patient not happy? Why was their survey bad? It's because of the nurse. And honestly, most nurses are really good. Most nurses really care. I mean, there's always going to be horrible nurses out there that don't care that they're sitting at the desk when their patient's hemorrhaging or decelling or whatever. It happens. And there are nurses that are very nasty. But ultimately, it comes down to the fact that it comes down that we are the ones that are causing patient dissatisfaction, but we're not. It's really the hospitals and the doctors are not educating their patients as to what they should be expecting. They tell their patients, oh, you're going to have a beautiful delivery, we'll induce you, but they don't tell them. Do they tell them you're going to have a balloon and it'll take 3 days and you may be in labor and have a lot of pain? No, they don't tell them that. So the nurse's job, while they're contracting and can't focus, we have to teach them, like, why do you need a balloon? Like, we have to talk about how it
Not to
works.
teach them, but like, um, bring them back to that down to reality. Like, oh,
Yeah.
you came in here thinking it was going to be a day. Now, not only do I have to teach them, but I have to like make it so they're not upset about it.
Yeah,
Like, there's no way
100%.
because this is what happened. This is how long it takes, and I have to say like, you're a flower. Like, it takes time to. We can't just rip you open. The flower will fall apart. We need time, and let's see what we can do to support that. Like, what activities we could try, what
Yeah.
movements. So I have to like quickly like
You have
squish
to
it
squish it in.
and
Yeah.
make it happy and make sure that they're feeling heard and all of this stuff because that's what we do as nurses. But also, are the doctors updated on she's got her meds in, she has her labs drawn, the baby looks good on the monitor, all this stuff. So and then we have to chart everything, and we're just like,
Yeah.
so something's gonna fall on the wayside, and unfortunately they're not putting that first one, mom and education, as a top priority because that's
No.
not, they can keep their job and get away with not doing it, but they can't if they spend their time questioning doctors or they have to chart everything. We have audits, they're like literally going and checking to make sure that we put the right thing in the right space
The
at the right
care
time.
plan. Yeah,
And
it's
like we're
all down to the nurses.
yeah, and if it's wrong, then in court we're the ones that are going to have to defend ourselves, and
Exactly.
it's crazy. And we're
It's too
we're
much.
we're
It's too much
broken, or we're just
response.
like can't do
Yeah.
it. They're going to lose a lot of nurses that
No.
they don't see the cancer that they're setting. So it's women are coming out way more educated. They're coming
Yep.
into birth and their partners, so they're getting better advocates. I can see it. It's just I can see in the last 5 years, just maybe from COVID, how much the internet and social media has attributed to women coming in more empowered.
Mm-hmm.
And I think that's going to increase trauma if doctors don't get on board and hospitals don't really start evaluating what, because the real people spending the money are those moms, right? Those families coming in with the babies. So are you really giving them what they want? Or is this like a monopoly? Everyone's giving you the same thing. So they're like, you're going to get what we give you. But we're
Yeah.
coming in a little more educated. And that's why we do what we do is ask these questions. Only it can come from them. It can't all the time come from the
The
nurse, right?
nurse.
Like we can't. Like
By the way,
and I
happy
would.
Nurses Week.
Happy Nurses Week. I know this is perfect. This
I
is
know.
it has to be awareness, right?
Mm-hmm.
So nurse, I don't think it's an awareness week, but we'll make it one. We
We'll
love what
make
we
it
do,
one.
right? I mean, I love being a nurse. My license is very important to me.
Yeah.
Um, I love working in hospitals. I do. I like being the one. I told my director, like, they're like, why don't you work at, no, my precept, she's like, why don't you work in a birth center or do home births or become a midwife? Like, why are you here? Right? Because that's how out of the box my presence alone is sometimes.
Yeah.
They said I can come off intimidating because I stand up straight and I look them in the eyes and I ask them real questions, and They know my priorities, and I'm trying not to come off like aggressive, right? But I
You have to
know
advocate for your patient. You have to do what it takes to help
I'm,
your
I'm
patient.
not advocating for the nurses. I'm advocating for
Yeah.
I'm advocating for our community as a
Yeah.
whole, and for these babies more than anything. They're the ones that are the future. So we have a lot to speak up about and take it very seriously, our job as nurses. But I
Mhm.
don't work in a birth center, or I don't do home birth, or become midwife because, something goes
Unfortunately,
wrong.
you
Yeah,
have to follow every single rule to the T, and if you walk out of line, you will hear about it. And it will be a complaint that will be written on your file. Meanwhile, I've seen doctors do horrible things. And I'm not saying doctors are bad. I love doctors. They save lives. But why is it a double standard?
yeah. We're
Because
throwing.
it's
They can. I've seen a
they
doctor
throw us under the
throw.
bus.
No, they throw actual equipment.
Oh, yeah.
They'll throw some forceps against the
Yeah.
wall during a C-section if you don't get their thing quick enough.
That's old school too.
Grow up. Yeah, thank
Yeah.
God for the new generation are not accepting that. They're like, no. And they really do have to, because it's not just the parents that are coming in more educated, but I think nurses are finding more of their voice. I think conversations like this, conversations like the ones that we had in what is the instinctual, which one did we do?
Intentional birth.
Intentional birth. That's an amazing series. I'm listening every day. I was like,
I
this is
know.
fascinating, and it's just
It's so
when
nice to see other nurses speaking up. I feel like we
yes,
all walk in line and
yeah.
we kind of just, you know what, it's my 12 hours. Let me just finish my shift. Let me do my task. Let me just get out of here because I don't have to think about it again. I have a day off tomorrow, So we
The
just,
only way, or you're gonna crack, you're gonna break, you're gonna.
yeah, you become
I'm
very
getting
cold.
anxiety attacks. Like
Yeah.
it's too hard. Like I can't. Like and unfortunately, once we cross that line, our eyes
Hmm.
are open to these things, to
Hmm.
the actual abuse, of everybody in the
Yep.
system. It's kind of like, how can I be quiet though? How can I be in this? And I understand so clearly why so many ahead of us left, right?
Yep.
Sometimes after 25 years, they never saw it. And then all of a sudden something in their life or some delivery happened, and they're just like it's like we were so trained that we were just living in this like
Yeah.
hypnosis or something, and
It's
then
true.
something happens and we're like, whoa, and we're shaken awake, and we're like, how are we doing this, right? And the more I
Yeah.
read, the more I study, the more clear it is, and the harder it gets to continue working there. And I get it. Like I understand so well why so many have left, and
And it's
you
so
kind of hold on to it.
scary.
Like I don't want to leave, but I like being like I told my director, I like being the ones that they call, like midwives. They have to call 911 if something's going wrong, and I like being the one to be ready for when they come. Like they're calling me to help with the most dangerous emergencies, or maybe they just need the epidural or something. Like, okay, I can jump in now because I have those set of skills, right? And I
Yeah.
and that's my one of my gifts, right? I'm good in those kind of situations, I feel. And
Yeah.
so that's why they would get a good nurse out of me. But
I know.
because I'm not quiet, because I don't fall in line as well, they're gonna lose a good nurse like that. And then
Unfortunately, the hospital doesn't care about good nurses. They care about the numbers. So
yeah,
it's so scary because what you're saying is so
that's
true.
crazy.
And yeah, and I literally worked in a hospital where every couple months there was 20 new nurses orienting and they did not even stay a year. And we were asking
That's
why and I was like, there you know
yeah,
the answer. It's
yeah,
because there is toxic environment here. There's not enough staff. We're overworked and we're getting abused. And we're expected to tolerate that and the younger generation is not going to tolerate that. And honestly, I'm scared because after this generation of amazing nurses retires, I'm scared of going to the hospital because it'll only be with like young nurses that are inexperienced that are trying to get their experience and leave, and
yeah.
who's going to be advocating for you? A new nurse doesn't necessarily know what to do, what to
No,
say,
it took
just
me
like you
5
said.
years to even realize what I needed, what
Yeah.
that meant.
Yeah. Yeah.
I was so consumed with just learning the how to put orders in and what protocols were, what the
Yeah.
policies were, how to work with doctors, how to call them and
Yeah, how to speak up
communicate with
and
them.
tell the doctor, let's try something else.
That takes
How to
skill.
talk back, how to talk back. Yeah.
Takes and it takes like 20 years for nurses to actually get heard back, like to respect
Yeah.
them back.
Yeah.
So I'm in
And
that
those
weird
nurses are
stage.
retiring. Those nurses are
Yeah,
retiring.
yeah, and I'm at that weird like 8 year mark where it's like either I become a leader, I move
Yeah.
on, and then I work towards getting that silent respect, and then but I'm not new yet. I'm not
Mhm.
new anymore, but I'm also found my voice, so I can question and speak up. So I'm at that like bratty teenage years of a nurse where,
Yeah.
and I either accept and fall in line, and the trajectory would be like now I'm charge or manager or whatnot because I know the policies, because I know how to do things, because I show up, I'm a good team player, so I could easily just and go that route if that's,
Right.
and most nurses, many
Do.
nurses do, because they need their job, because they enjoy
Mhm.
what they've learned, their eyes, they never had that experience that like shook them open, and I did. So I mean that's why I created my friends a nurse, because I said either I have to like do something outside.
Mhm.
I can still be that liaison, I can still help doctors educate their patients or provide services that are missing, and I will be targeting doctors that appreciate that. So it's not like my job will be on the line at the hospital
Mhm.
because uh, I don't work well with their value system. I just don't work with them, you
100%.
know? And
You
then
want you don't want to we don't work for the doctors, but we do.
we do.
Because everything goes back to the nurse and the doctors are always right. Do you know what I had told to me? In my first job, there was this case where the patient was not doing well. I escalated it to the third year. The third year said, "No, she's fine. The tracing is fine." I was like, "No, it's not." I kept turning her. I turned off the pitocin. I said, "I want you to evaluate this patient." "Oh, it's fine. It recovered. Whatever." So that patient had a bad outcome, and when the I spoke to the director about it because I was very upset. And I told the charge nurse the house attending was actually not on the floor, which she shouldn't have been off the floor. So I had nowhere to turn to. And the director literally told me, "Sarah, you are a nurse, you have a license, it's your fault. The resident is just learning." And I said, "Really? He's a third year." He or she was a third year. And I told her I went to the charge nurse,
And
like
why are we
I
taking orders from residents?
yeah.
Why are they giving me an order to do
Exactly.
something if I'm
Exactly.
not supposed to
And
listen to them?
exactly. And this resident is going to be an attending next year, right? So she told me, "No, you're a nurse. You should have known better. And it's on you. And you didn't do the right thing. It's your fault the patient had a bad outcome." I promise you. I was crying so hard because I felt guilty, and my husband was actually next to me I put her on speaker, and he was like, "That is not how you talk to a nurse. That is not a nurse leader. That is not teamwork. A nurse leader says, 'Let's come in and let's debrief with everyone and discuss what happened, and let's change for the next time. Let's learn
Yeah,
the steps for next time to avoid poor outcomes.'" Do you know how scared I was after that? That my voice means nothing and
yeah,
everything is my fault and I don't trust anyone that I work with. And she told me, "The charge nurse, why would you go to the charge nurse? She she has her own patients." So basically you're telling me that no matter what I do, it's my fault. Is that what we're supposed to teach nurses? No, we're supposed to be support for them, give them resources, give them tools, teach them how to escalate things, not put them down. And that's the hospital system that nurses are working in every day. Like, that's not okay. And that really broke my heart. And ultimately, I left that. hospital to a different hospital. But I see this all the time. It's not the same words, but the doctor's always right, the nurse is always wrong, and everything falls back to you could have done better. Do the doctors get spoken to? Not always, because they bring in the money. But the nurses, they're trying their best. They have two patients, they're running back and forth. I used to have two fully patients. I was pushing with two fully patients, one room, that room. The babies would have came out by themselves. But what can I do? My hands are tied. And all I heard was, Sarah, you're not good enough. Sarah, you have to do this next time. And I was just fed up because ultimately, that's not how the hospital should work. We should really give resources to nurses. We should really be supporting them. And I felt bad for the patients. Because imagine we get burnt out. When we hear this, we're like, okay, we put a wall up. We just come to work. Let me just scan my badge in. Let me take out my Pitocin. Let me start my Pitocin, and we're not there for the patients because we're scared to voice our concerns. It's just a vicious cycle.
Yeah. I get talked to or looked at more like if I turn the patient frequently in all these different positions, I get looked at like, what are you even doing?
Yeah.
More frequently than if nurses that leave their patient in one position for 3, 4, 5 hours.
I was
Not, they
never
don't bat an eye.
taught.
They never bat an eye.
Yeah,
It's
I
crazy.
was
Because I'm
never.
turning there and they're like, okay, whatever. That doesn't work. Just keep increasing the Pitocin. I'm like,
Yeah, I have to say,
what planet are they on?
I was never taught all those positions. Never.
Not formally, no. I
Nope.
think they did a good job bringing like Spinning Babies poster up and then providing the peanuts.
Yeah,
Um,
they
but they
just brought
didn't
the
they
peanut.
didn't do simulation. They didn't do a class. Nothing like that. They're kind of like, hey, patients are asking for this, so here are the peanut balls.
Yeah,
How are we supposed to use them? Nothing.
I
So
would just turn them left and right and just keep turning them every 30 minutes. I would just turn them.
yeah,
The doctor would come in and say, I'm going to section her at 2 p.m. So I'll come in, I'll check her, and I'll just have the OR ready for me. And I'll be like, okay. And I would run, get the peanut ball, turn her left, right, left, right. I don't want to do a section. Like, let
no,
her,
no.
let's give her a chance. And it would work, but now I learned that you have to know where the station is. You have to know if it's OP, and then they would walk in and they would say, "Oh, she's OP. Let me get the sono, but I'm gonna section her." And now I know.
And I
Only
also I
now.
think it's so funny. I'm like, okay, you're gonna get the ultrasound to tell you what? Okay, the same thing I just told you. What are you gonna do different? Are you
to
gonna tell me what position to
confirm
put her? Yeah.
to
So
confirm that she cannot have a vaginal delivery because she's OP, and
and you
I
go,
had a
and I
vaginal
go, but that's not
delivery.
true because we delivered plenty of OP vaginal babies. I had one mom pushing her OP baby out in 3 pushes.
That's awesome.
Because we've been moving, we've been doing things. She's had a great healthy pregnancy. She has other babies at home that she was able to push. That baby was big too. And I'm
Wow,
like,
that's
so
awesome.
who are they to say you can't do it without the right? Like, the problem is we're not, they're telling, and this is what gets under me is like, don't tell us we're trying to decrease the C-section rates. Like, stop
No.
lying,
Yeah.
because to do that, you need to promote a physiological spontaneous vaginal delivery. How are you doing that? When
And
you're
give them time. You're
yeah,
not giving them
you're
time.
not giving them time. You're not teaching the nurses how to promote physiological birth. They're just all scared of it.
Mm-hmm.
They scatter like roaches when the thought of a mom going without an epidural and just on her own. They're like, "Ugh, I don't know how to manage. She's going to be screaming and stuff. I don't know how to manage that." Right? You don't have doulas on the premises to support that, even though evidence shows that it does. You have the products, but you're not using the tools, right? Like, how are you
Mm-hmm.
promoting them moving around more? Are you providing nitrous gas to everyone? Are you teaching them about it? Like,
We
what
don't
other
have that where I work.
that neither do I. Like, so those little things show me like you don't really care. Like,
Yeah.
you don't really care about moving them away from the OR or at all, right? And
Well, it's better for them cost effectively because they get paid more to do a C-section, and then
yeah,
they could go
it's less
home and
time. They get to the patients, instead of going home after 24 hours, they leave after 72.
Hmm.
Oh, so they stay there longer,
Yeah.
right? The recovery's
And they
longer.
get, and
Doctors
they,
only spend 15 minutes. They can do it quick, quick, quick and out.
hmm,
We get the room back.
yep,
Tell me it's not true. Like,
a
why are
hundred
they lying?
percent,
and
a hundred
and
percent.
we need to get in line. And we're here like, why are you cutting all these women open without right cause? I'm a woman. Like, now it's my risk. It's my daughter. I look at it. I look at my daughter and I
Yeah,
said, what are we leaving her with? We're just telling her body doesn't work, right? And then it just goes that far as women, and then we're just taking the power away. And they're coming in educated. They're coming in ready to do what they need to do, right? And we're just like, we're good. No. Let us take it from here. And more than likely, you're either going to have some kind of medication or a C-section.
yeah. More likely a C-section for sure. I've seen it time and time again, and it's so scary. When I was pregnant with my first, I was petrified. I didn't realize I had so much birth trauma in me until I was pregnant. And I was like, where is this coming from? It's because I saw it, I saw horrible things, and I realized I was scared for my own delivery.
You
And
got pregnant after you became a nurse, Elena.
yeah, I
I
was working as a nurse 3 years after when I got pregnant with my first. I would have panic attacks. I would be crying hysterically, worried about my delivery. Like, I didn't know how to cope with it. And I realized only now, well, actually, after my second, I realized that I had birth trauma from other patients that I took care of. And I realized it's because doctors did not have their best interest. They just wanted to section them, get out of there, go back to their office. They didn't give them time, they didn't educate them, and I was petrified that it would be me, even though I knew everything.
Well,
And it,
that's to us. Can you imagine the moms? It's almost it's almost better they don't know. They Some of them think like,
yeah,
I
they
don't
think
want to
God
know.
is their doctor. God is their doctor, right? They,
Yeah,
whatever the doctor
yeah. Like,
says.
why should I know anything? Like, I'm not going to question them. I'm not going
No.
to, like, what do I know about birth? Like, let
Yeah.
them do it. They're the experts. Let them take over.
Yeah,
And
they're gonna tell me everything I need to know. My doctor has my best interests at heart.
more
My nurse
stressful
has,
on me to worry like you did, right? I was less stressed because I kind of took over. I managed my care a lot, and
were you a nurse already?
yeah, and like 4 years in, and so I wasn't as awakened as I am now at all. But I still, and I'm like, oh my God, maybe I know too much, right? But
Yeah,
I did a very good job choosing a doctor that I trusted her intuition, and
same.
she was very caring, and her bedside manner matched how she treated the nurses.
Hmm.
So many doctors will have like the best bedside manner, and then they'll come to the nurses
Yeah.
station like, why didn't you do this? Why didn't you do that?
Or they will be the best and the sweetest to the patient. They'll come out of the room. They'll be like, she's so annoying. Like, I can't wait to section her.
It's fake.
And
I've
my
seen
mouth would drop because I would see them hugging the patient. And I'm not trying to scare anyone about their doctor, but some people don't even meet their doctor till the day of the delivery. And that freaked me out
right.
even more because you don't know what you're getting into. And I try to educate women all the time, like, research your doctor, make sure you meet everyone in the group, know who's on call, have appointments with all the doctors in the group, because when the day comes you might get a doctor that you totally do not jive with, and that doctor may be prone to section faster, and what are you going to do about it?
Right. So then it's like there's this spectrum of doctors then
Mm-hmm.
that are very much like, chop chop chop, it's my way. I'm the experts. I'm here to help you. Get on your
Yeah,
back. There's my light for me. Everything is going to be about them and what they need for your birth. The nurses are going to be placing the orders. What do they want to do? I'm going to check your cervix every 4 hours. I'm going to give you
oh
pitocin
my
now, and
god,
you have 18 hours to deliver. Is that the kind, like, so during prenatal visits you have to start talking to them about that. And
yeah,
even if it's not going to be the doctor that you end up delivering with, at least you have been practicing. If
Mm-hmm.
your partner is there, they can watch you or they can
Mm-hmm.
practice having that discussion. Hey,
100%.
I'm curious, when you enter the room of a birthing woman, do you say, hi, I'm here? Or are you more quiet? Right. So that's an indication. I bet no one's asked them before. They're like, oh, I say, hi, I'm here. And it's like, so then that's my little clue. Okay. So it's going to start off then being like, it's about me. Right. Hi. I see nurses do that too. They're coming in the room and patients, heaving and breathing, and they're like, hi, I'm so and so, I'm gonna be your nurse today. Da-da-da. Like, this isn't about you, right? And the doctors too. And I would think they need to start understanding that. And then on the opposite end, when you're looking for a doctor, is the
Mm-hmm.
doctor looking you in your eyes? Are they at your level? Are they actually hearing you? Do they have follow-up questions for you, or do they get
Mm-hmm.
defensive every time you bring something up? Because a lot of doctors, if I ask a question, they just get defensive. Why are you even questioning what I'm asking you right now?
Yeah.
The
It's
order's
a
in, watch it. This is a discussion. I know you don't want to learn. I know you're just questioning it because you think I'm wrong. That kind of attitude, right?
it's an
And they're doing it to
insecurity.
us. Yeah,
A
they're
lot
gonna
of
do worse.
doctors have a lot of doctors have an insecurity, and when you start to question them, they get very ugly. And you're just trying to understand what they are saying, where they got their evidence from. Oh, I never heard of that. Can you teach me? And they just kind of brush you off because it's their way or the highway. No
Yeah,
questions asked.
100%. And if that's the kind of doctor you have, it's going to show up at your prenatal appointments with how you
Yeah.
question it. If you don't ever question it, then you're never gonna know. And we're not saying that that's how your doctor is, but you don't, or is the day of how you're going to find out, right? And you may never know.
Mm-hmm.
You may
You may
never
never
know.
know.
If your
Yeah.
nurse is following, is a great nurse and she's keeping quiet, and the doctor has great bedside manner, but you are getting like the interventions and everything's kind of happening. She's very sweet.
Aggra-
Yeah, she's very sweet and like comforting. Like, I know
mm-hmm.
you want it to be pushed on your side, but let's just do a few times on
Mm-hmm.
your back and see how it goes. I know, like you're pushing really well. No, you're pushing great, but let's just see. Let's get on your back and just see how this feels, right? And as you get on the back, she kind of like reaches over and grabs the light. All of a sudden, the light's on you, and you're in outer space, right? And your partner's just like so excited, and they're like, I'm not gonna speak up right now. Like, forget it. And they're just
Well,
gonna,
because the partner knows the doctor, thinks the doctor knows best.
yeah,
So
very
when the
hard.
doctor says something, they'll take the side of the doctor. Because
Mm-hmm.
what do you mean? The doctor knows best what to do for you and the
Even I saw
baby,
like
right?
how they, yeah, even like asking the doctor to wait until the umbilical cord is white. So it's like you're in the middle of the birth, it's about to happen, and you're like, you just met the doctor for the first time, she's in between your wife's legs, and you're like, hey, we wanted to,
It's intimidating.
more than a minute, more like, can we wait until it pulse? And that's kind of like how, hey, could we please
Mm-hmm.
wait on my baby to cut the cord? Is that okay? Can we do that? And that's like kind of how you have to, does that work for you? Like, and they're like, yeah, sure. We can see if it works, and you're gonna end up getting hopefully what you want, right? They want to if they can, but
Right.
they get very defensive, or their egos are a little big. And they're like I wasn't gonna do it right. I was gonna delay it. I was gonna wait until whites, but now that you asked me, I'm gonna be mad about it. Like,
Mm-hmm.
yeah, and I have to see them ask like that, like, hey, do you think we could wait, or do you have any do
Because they never practice the advocacy muscle, really.
yeah, yeah.
It's like kind of like when the resident comes in and we're gonna break your water, and they just go and break it, and they never explain the risks, the benefits.
Mhm.
Maybe baby's high. I mean, maybe she's not really dilated, and it's not a
Yeah.
good idea because she might have a cord prolapse. Maybe.
It's such a pet peeve of mine when doctors
Yeah.
do that, when they come in and they rupture without a really good conversation to know,
Mm-hmm.
is this really something the patient wants? If it is appropriate and the benefits outweigh the risks, then there shouldn't be a problem having a mom agree to it, right? It really shouldn't be. Why are we so hesitant to give them that full picture and give them that power? Like, how can that affect your bottom line? Like, really? Like, come on. It has to be some kind of ego thing, but it's like she would rupture them. She wouldn't give them risks at all. She just let speed things up.
Yeah.
And then
This is gonna
then she
help
does
bring the
it.
baby.
And then she comes outside of the nurse's station and she's like, okay, so she has 18 hours and check her cert, keep checking every 2 to 4 hours
To cause an infection.
to make sure that she is making progress and making change. I put in IUPC, so we'll be able to see if we can go up on the Pitocin and just make sure we get rid of those variables or lates that just started because they ruptured. And none of that was discussed. Yeah, we're going to take her temp every 2 hours because now infection has increased. You just listed off 4 different things that I have to be aware of now and that are big risks to move her into the OR. And you didn't warn her about any of those. Ugh.
Colette, as you were saying that story, I'm rolling my eyes because I heard it every single day.
I what? Why is it so hard? Like, why is it so hard? And
Because they are taught in residency by the third year or the fourth year. This is what we do. We come in and we tell them we're going to break their water, and we break their water, even if the baby's high. Because if we have a crash, at least we learned about it, right? We learned what to do in a crash so that when we're going to be attendings, we can do it, right? Do you know how many times I had a patient who was a multip that I admitted for induction? And I started her IV. I told her, okay, the doctor's gonna come in and check you and see what we should do, whether they want to do a balloon or whatever. I always tell them what's gonna happen. And then the charge nurse says, Sarah, go to lunch. I said, okay, great. I go to lunch and I hear, open the OR. And I said, and I hear my patient's room number. And I said, what? I come out, even with my food in my mouth, and I was like, what happened? I literally just left. Everything was fine. Baby was category 1. Mommy was happy. She's a multip. And I find out the resident came in, broke her water without a nurse in the room, and screamed cord prolapse. And everybody had to drop their patients and run to the OR and do a crash C-section on a multip that was a scheduled elective induction. I mean, I have no words.
I don't have any response. Like, I want to start crying.
Yeah,
Like, I'm
I
like,
really did.
yeah, that's crazy.
Yeah,
So that's where we're at.
yeah,
And I know I'm like gonna cry now. Like, because
yeah.
it's
I'm
not just
telling
her.
you.
Like, I see it almost every shift,
Yeah.
right? She had the worst case scenario.
I mean, it happened all the time, though, Colette. It happened
Yeah.
all the time.
Yeah. Yeah.
And not just,
Be
okay,
aware of teaching hospitals, that's for sure.
yeah.
It's
And,
sad because it shouldn't be that way because some moms don't have a choice of where they can deliver or how
or
they've been
they,
built to believe like what they need.
mm-hmm,
Um, but we're just lying. Like we're
yeah,
not doing the best for them. We're not looking
yeah,
at are we causing harm?
yeah.
Did they take a vow? Like what's going on? Don't they want to give a service that these women want and can value and that supports the community? What the hell? Why are these stuff? I have to start talking to OBs. Like I have to. I
You
just
know
don't
why,
know
Colette?
who.
Because they want to deliver. Let's just deliver this patient.
Mhm.
What is the
But then they
quickest
have faith.
way?
If the baby's healthy in the crib and
Yeah.
mom is alive and not bleeding, have a great
Mhm.
day. I did my job. Next one. Oh, I couldn't be an OB. Like going to sleep every night with the because it's not just that one. It's they have hundreds of patients,
Yeah.
right? At one time. So
Mhm.
multiple, maybe 1 or 2 deliveries a day. That's a lot
Mhm.
of pressure to make sure that they all go right. So they could just cut it right there and and then cut their own wrists. So it's
Yeah.
all this is the mom's one baby and one pregnancy.
Yeah.
And the
And
doctor
this
has
affects
hundreds.
them. This affects them for the rest of their life. This section, this crash section, first of all, birth trauma. I had patients tell me after I have nightmares of being on the operating table and them cutting me. And this is very traumatic for the rest of your life. And second of all, it's going to affect your delivery for your next baby. The fact that you can have whether you can have a VBAC or not. I mean, some doctors are not comfortable whatsoever. They lie to their patients. Yeah, I'm totally okay with VBACs. I love VBACs. And no, they pretend like, yeah, we'll give you time. Oh, and they come in and they check the patient. They're like, you didn't make any change and this baby's not going to come. And last time you got sectioned for the same reason, let's just do it while baby's heart rate looks good, so it's not an emergency, so that you and your baby are going to be okay, and let's just do another C-section.
Yeah.
And these sections are the reason why we have so many complications. It's so scary.
Yeah. I don't know. I don't they're not showing real true signs of even caring or wanting to change it. I do see it on the outside though. I see
Yeah.
nurses speaking up louder. I see women going and educated. I see, that's why I'm coaching, right?
Yeah,
I'm not,
that's why
everything's
it's so
evidence based.
important.
Yeah, everything's evidence based. We try to keep it as affordable as possible. It's going to be cheaper than anything, anything that happens if
It's cheaper than having to recover after a section.
yeah, just knowing that you have it's like I had a client that I was there for her to text me if anything was happening
That's awesome.
and she was able to make decisions based out of being informed and then also just knowing someone had her back, right?
Yeah.
Someone was there to give it to her straight, right? That doesn't mean I'm telling them to go against the doctor or
No,
to
we love
decline things
doctors.
or anything like that. Obviously, bottom line for me is to make sure they understand the risk to the baby and herself
Mm-hmm.
acutely. Like that's how we're trained to only think about that.
Right.
As a coach, I say we make sure and think about that, but it's a bigger picture. Like
Mm-hmm.
is the damage to your values and your morals and to your privacy and to, you know, your safety now to postpartum to newborn years to your future pregnancies to just being a mother. How is this
Yeah.
going to affect that? Like as a coach, we can really get into it outside. You don't have time to do that in
In
the
the
time
delivery
of your
room.
birth. The nurses cannot be the ones. We are there for specific reasons to monitor that baby, to monitor your vital signs, to give you medication, to move things along the way the doctors and the hospitals want it to. We're just factory workers and we're just do what we want. Our eyes can catch things before even machines sometimes.
Yeah.
And we have to be great bedside nurses, caring, supportive advocates.
Yeah.
But this job is very difficult. So as a coach, I'm finding a lot of value in that part of it, like the supportive part that I want to do as a nurse, and this one that says, no, you can ask these questions.
Mm-hmm.
No, ask questions if you have a question, or trust your
Mm-hmm.
intuition. What's your gut say? What does your doctor's gut say? How does that fall in line with how you're feeling and your level of safety and your level of respect? Like
Yeah.
really have to dive into that. You have to do it early in pregnancy, even before you're pregnant. Start really working on that muscle and learning those skills, those leadership skills, right? How do you advocate? And then I don't even have to be there. It's so cool when, I mean,
I love it.
I also support them to get doulas, right? Because then there's
Yeah.
the hands and eyes and just that level of protecting that space is invaluable, right? But
Mm-hmm.
if they can't get a doula and they just have me, they know how to create that, like, right?
Exactly. You hit it on the nail because I have patients ask me all the time when I do my childbirth classes, do you think I should get a doula? And I say, honestly, it's worth it if you have the money, but taking a childbirth class is completely different because it gives you the foundation. You can't just show up to your delivery and the doula will do everything for you. You're still going to have fear, you're still going to have adrenaline running through you. You're not going to know the proper breathing techniques when you're having a lot of pain and you can't focus on the doula, right? You're not going to know what to expect, what a vacuum delivery is, what an emergency can look like. And having a childbirth class like yours or mine will really set you up for success.
Right.
It's
And
your
just
foundation.
having a nurse that you can message, that you can text and be like, hey,
Yeah.
my doctor said this,
It's
but I don't feel right
invaluable.
about it. She texts in general, they don't text me much once it's game time,
Yeah.
once or twice, maybe. Like postpartum, I get a recovery question, right? Like, hey,
Yeah.
how soon can I go home? I'm like, well, how are you feeling? How did the birth go? Like, do you have any complications? What are the nurses telling you? So it's just dialogue. It's just conversation. And then
Yeah.
at the end of the day, I give them their options. You can stay another day just to make sure if you feel safe, if you feel strong about going home, and that the option is to sign out AMA and speak to both of your doctors, try to figure
Mhm.
out a follow-up plan and make sure you review signs and symptoms to look out for when you go home. But the power is yours. And they're
Yeah.
like, it is. It is mine actually. And they understand the
I
full
love
picture.
that.
Yeah, and they have understand and they're like, how many times I say the nurse was so mad. She just came in and I was like, they take it like they take it so personal. Like she doesn't like they're so mad at me. And this nurse, she came in like ready to fight. I'm like, damn, like I would
I
never.
love it.
If I know they're educated, I'm like, okay. I was like,
Well, you're
unless,
educating them the correct way. Like you're a
right.
labor and delivery nurse, you're giving them the knowledge of labor and delivery. So honestly, the nurses love it. The doctors tell me they love it because their patients actually know what's going on. When they're talking to their doctor, they know what questions to ask. And if their doctor says, "Oh, you need X, Y, and Z," like they are like, "Okay," because they know that that's the norm. They know that's what's expected, and they know
Yeah,
what's not normal. And honestly, you're even helping the labor and delivery nurses. You're helping the doctors, and you're helping the
absolutely.
hospital system because people are having a more positive birth experience, and
I
they're
like
having
it. Yeah.
yeah,
And that's why
the
when I'm
doctor.
working at the bedside, I'm like, don't you guys don't you guys know what I can offer you guys? And why is this a problem? Like it's just I'm just educating them and giving them their options for all sides of it. Like
That's yeah,
and most of
but
the
that's
time
why
they're agreeing to do the things that we're recommending because
yeah.
and they feel empowered by it, right? I'm taking a
Mhm.
few minutes to describe things. And unfortunately, sometimes it's just not enough because they don't have those leadership skills. And I'm definitely not going to say certain things in front of the doctors
Exactly.
that I could probably say outside, right? Because I'm
Right.
not
And they're
working for them.
yeah, and they're also in labor, so they can't process information
Right.
the same as when you're
Absolutely.
pregnant and you're watching and listening to a class, engaging in a class and taking notes and asking questions with the right frame of mind with your support person at your side so that
Right.
your
Way
support
less fear.
person, yeah, it's
Yeah.
different. Like, how can the fact that they expect nurses to educate patients while they're in labor is really absurd. Like, how much can you absorb when
I
you're
don't even think they
screaming?
expect them to. I don't think anyone's like they say it, but
Yeah.
I don't they're not really giving us the full rundown of
No.
they don't want us to do that. No
Yeah.
way. it's 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 a shame. I think time is money as well.
Yeah.
Yeah, I think so now
Take a
we
childbirth class, guys.
take a childbirth class, get a coach. A class is great, but to have someone it's like a class but that you can go back to a coach can you can a doula that can be your coach that she's you can message when you have questions or meet regularly with to go over like that's how I do it. We meet weekly and we're going to go over how the week was, how we're
Mhm.
feeling, what concerns do we have, what fears, and
Mhm.
we can start the call off with like no, everything's pretty good, like I'm just next week we have my glucose test, but other than that, I mean, I'm at the we could start out like that, but I promise you that call still ends up being an hour. And
Mhm.
I give her some hot tips and like big
Yeah.
things to work on that I know just change the trajectory of her whole
100%.
birth.
Cuz
And she
knowledge is
started the
power.
conversation like, no, there's nothing we can talk about. She probably came to visit like, I don't know what she's going to tell me.
Mhm.
But we know so much. There's so much to tell you. And you all I need is a little clue or hint of where you're at and what you're looking for. And how your doctor's acting and what they're saying to be like, okay, now let's the picture is slowly getting painted of how your birth is going to look like every day, right? It's
Yeah.
and the more you learn and the more you follow through with having that conversation with your doctors and making that my patient we would my patient my client we would speak weekly well all of them but the last one
Mhm.
I had no. She's like, yeah, and then but I had my birth plan. She was telling me debriefing her story. She's like, I had my birth plan. I'm like, you made a birth plan? I had no idea if she even made a birth plan, right? Because we discussed what a birth plan meant, like how it works. We get deep into that. But I'm not like, show me your birth plan and tell me all the things on it. Like, we never get
Mhm.
to that point. It's
Mhm.
so, she's so in her hands that if
Mhm.
she doesn't have concerns, I didn't even know she made one. And then she told him, was
Exactly.
like, that's okay. And then she was telling me what's on it. She didn't get an IV. She didn't, like, all the things. I'm like, I didn't
Wow.
even know. I didn't tell her not to do any of those stuff. I didn't tell her not to get an IV. I didn't tell her, right, to leave in 20 hours instead of staying the 24 to 48. I didn't tell her not to get Pitocin after delivery. I taught her what active management of third stage is, right? I told her this is
Yeah.
what how they give it and this is why, right?
Yeah, that's what
I
I
went
do, and
over
the
baby
choice is
medications.
yours.
I went over baby medications with both of them. All
100%.
I showed a podcast. I did this explain. I showed where to go to study it and to have the conversation with the doctor. I was like,
Mhm.
talk to your pediatrician and talk to him. I gave them
Mhm.
those tools, and then they're
I
like, "Good." We
always
did everything. We did all of that, and we made the decision to not give our baby the medications. I was like,
Mhm.
okay, right? I was like, but they're very like, yeah, we made that decision. They felt so empowered to do that,
Yeah.
and that was them, right? I
Mhm.
have clients that gave the medications, that had a C-section, that like the spectrum is all over the place, but what
Mhm.
they all have in common is that they went in fully empowered and educated and feeling supported, and so that they
That's so
that
awesome.
debrief was like, yeah, yeah, it happened. Like, crazy C-section happened. She came in 10 centimeters breech, like she had to get run in. She ended up having general anesthesia, like nothing that she had planned, nothing that we had talked about, right? Did we talk about a little bit about that happening? Yes. We talked about it and then we left it alone. But it's crazy that it happened. She's like, no, I think, I still was, I did a lot of, she worked really hard on mindset and breath work and that sort of
Well, she
things.
got to 10 centimeters.
I was like, you could have had
Wow.
a vaginal delivery. I
She
bet
can
you
definitely have a VBAC next time. That's awesome.
100%, 100. But then they did an incision on her that was more vertical,
Oh,
right?
that's sad.
So that classical incision is going to make it harder. So now but she's not pregnant yet, and with her mindset and attitude, if it's possible, she'll probably learn how to do it, right? She's so that's how I think most women are, and I'm excited to see that they take the power into their own hands and choose doctors
Yeah.
according to that and not just like the location and stuff, because you just never know what you're going to get, and we're all kind of suffering in this hospital system right now, and I don't know how
Yeah.
much longer I'm going to last, if I will, um because it's I have to think about my mental health as well, and where I would be the most help and benefit, right?
Yeah. I actually have to add that I feel the most reward not from pushing with a patient for 3 hours, not from for getting a patient to have a vaginal delivery, even though the doctor said that he's going to section her. I get my most reward from giving my childbirth classes and then having my patients, my clients text me or call me after the delivery saying, I had a beautiful delivery and it was so positive, so empowering. My husband remembered everything that you said. And I look back and it was amazing. And
Yeah,
that to me means more than
yeah,
catching a baby in labor and delivery or,
yeah.
it's just so empowering.
I actually agree with that. Yeah, I get really excited. I was like, and
Yeah,
it's
it
just
makes my
them. They did
day
it.
to
They did
know.
it. She did. I didn't have it. Like, that's
Yeah,
amazing. Oh, I feel so good. Yeah. All right.
that's
Well,
awesome.
Sarah, I feel like I could talk about this all day.
I know, but I kind of feel a little bit better.
I do. This is a good sesh. I think more
Yeah,
nurses should do this. I just want to give a shout out again to the inspirational. Is this what it's called? Inspirational birth? Intentional?
intentional birth. Yeah, they sparked something in us.
Yeah, and I've been reading, I've been listening to it every day, and just
Yeah,
especially what
it's
I'm
awesome.
dealing with right now, and on the verge of leaving, and just to hear other nurses feel supported. We need that, especially when we don't see it in the unit, right? Because the nurses are kind of not in that
Yeah,
mindset, or you don't hear about it. So then to
yeah,
hear about it has been really eye opening, and probably most of my content this week is about it, and because that's what's going on right now. So I thought this was a great topic to go with this week. And I'll probably put it on YouTube. I think this is because now it's a longer one. I'll put it on YouTube. We'll cut up some clips and put it on Instagram and maybe a podcast because I feel like this was good.
Yeah, I love that. Thank you so much, Colette. Happy Nurses Week.
Happy Nurses Week.
Thank you for saving lives every day and to help teaching women before they even step into the birth world.
Right back at ya. Bye.
Bye.